In the US today, 70 million Americans have problem paying off medical debt. Medical debt is the #1 cause of bankruptcy in our country. Meanwhile, health insurance CEOs are making a killing off of this system. In 2017 alone, health insurance CEOs, by a great majority, gave themselves bonuses, normally making 300 times the amount of money of their average worker. These executives are literally like parasites, sucking the life out of the US healthcare system.
With the US healthcare system in crisis, a lot of folks are pointing to Medicare for All as a solution. But before we get into solutions, let's think about how this whole thing works. What moves the money? If you're sick and you're seeking healthcare, someone's got to pay. And ability to pay or payment in general depends on your age, your immigration status, citizenship, employment, and above all, how much money you got in the bank or your income.
Today in the United States, 49% of people in the US get their insurance through employers buying insurance from private companies. 21% get their insurance through Medicare, 14% Medicaid, 7% buy their insurance directly from private companies, and 9% of people in the US don't have insurance. That means around 30 million people in the United States today don't even have the baseline shitty health insurance that we offer. That also means that around 160 million people, or half of the US population, get their insurance through employer-based plans. Wait a second. If these insurance companies are paying for our health care, maybe they aren't that bad.
No, hold up. These are for-profit companies whose main goal is to increase their profits by decreasing their costs. By the way, the same underlying for-profit logic drives companies that claim to be not-for-profit. Insurance companies straight up deny covering healthcare that we need. And on the other hand, they try to discourage members from seeking out that care through copays, which is a fixed fee per service, or through deductibles, sometimes up to thousands of dollars per year before insurance kicks in, which can make or break a working class family. Let's pause right here. These are potent ways for insurance companies to penalize folks who are trying to get care. Does that make any sense to you?
And these disincentives, they have human consequences. When people delay seeking health care, conditions that could have been treated easily can become potentially fatal. I see it every single day in my clinic. Somebody coming in, afraid of what their healthcare cost is going to be, delaying care, and now a blood pressure or a blood sugar, which could have been controlled in the early stages, becomes extremely dangerous.
So where does Medicare for All come in? This would be one system covering everybody, healthcare as a human right. Poll after poll shows the vast majority of folks in the US prefer a Medicare for All system. So why hasn't it happened here? Just like it has in basically every other industrialized country. Well, that's because the ruling class loves the current private insurance company system.
And what's with this health insurance system in the United States anyway? Why does somebody have to be insured for health care? It's almost as if we're not supposed to get sick. Something that you're not supposed to do. And if you do get sick, then that's your fault.
This is becoming such a hot issue that pretty much all Democratic Party presidential candidates are now claiming that they're for Medicare for All. But only 1 or 2 candidates are really explicitly for eliminating private insurance companies altogether. The rest are just trying to use the brand Medicare for All without actually changing a damn thing.
Wait, what about Sanders and Warren?
Bernie Sanders and Elizabeth Warren do talk about totally eliminating private health insurance companies. But even if they do win elections, they're going to face a ton of resistance from Capitol, not to mention their own political party. And that means many actors in the medical industrial complex, including pharmaceuticals, device manufacturers, private hospitals, they all want to get at that piece of pie. There's one more huge consideration. Millions of working class people gain their health care through their jobs. That means they're in an extremely vulnerable position in the context of organizing for improved conditions, benefits, workplace. Because if they lose their job, they lose their health care.
The capitalist class is not going to give in that easy. They love and continue to benefit off of business as usual. The only way we're going to win national improved Medicare for all is through mass working class mobilization. And if you're in a union, that means pushing your union to support national improved Medicare for all without a doubt. It will still be far from an equitable, socialized healthcare system, but it will be a huge step forward for the working class.